was a man who knew world leaders and what really made them tick.
He talks about economics in a very simplistic way. One almost gets a sense in his description of his views of Russia that if he commands it, it will occur. And there's almost a Ross Perot-like character, as if his very persona and his very loyalty to Russia should be enough.
That was posed on this program in 1996, assessing General Alexander Ledbetter, who had taken third place in Russia's presidential election.
Gerald Post was a psychiatrist and founded the CIA's Center for the Analysis of Personality and Political Behavior. For more than 2 decades, he profiled world leaders, assessing their strengths and vulnerabilities. Among them, Saddam Hussein of Iraq, Kim Jong-il of North Korea, and Anwar Sadat of Egypt.
Post delivered his analysis to the highest levels of the U.S. government. He interviewed terrorists, studied suicide bombers, and after September 11, 2001, he told NPR's Morning Edition the war to come would not be won with traditional methods.
This is a war for people's minds. This is a particularly vicious species of psychological warfare waged with these symbolic acts. And you don't combat psychological warfare with bombs and missiles. You combat it with psychological warfare.
After Post left government, he started a consulting business and taught at George Washington University. According to his daughter, Mary Gramlich, he saw patients virtually until the week before his death. Gramlich calls her father curious and inquisitive.
He'd have 3 newspapers, and he'd have piles of books, and he'd say, did you read this? What do you think of this? And he'd share his opinion. There'd be people at the dining room tables just listening rapt to his ideas about what was going on in the world. What does your dad think of this? We're always asked. What would you say about this?
He wrote books of his own. One of them, called Dangerous Charisma, profiled President Trump. It broke the American Psychiatric Association's so-called Goldwater rule, which prevents medical professionals from commenting on the mental health of political candidates.
He's not a why guy. He's a why not guy.
That's another daughter, Cindy Post. She says her father respected the APA and was a longtime member, but she says he thought publishing that analysis was worth the risk.
If this was against their rules, then so be it, because he felt that their rules needed attention and needed review. Immediately, not sooner.
Last month, Gerald Post became one of more than 283,000 people in the U.S. to die from COVID-19. He was 86 years old.
Considered from NPR News.
And this is KUOW 94.9. Thanks for dropping in this Monday. I'm Kim Malcolm. Coming up, hospitals reportedly seldom, if ever, test their employees for COVID-19. And many workers there believe this puts both them and their patients at greater risk. Closer look at this question in the next 10 minutes after our local news update next.
Support for KUOW comes from the dining and retail tenants at Seattle-Tacoma International Airport, including Paulino Pastoria in the Central Terminal, featuring freshly made pizzas, pastas, and Italian-inspired sandwiches for travel. More info available on the SEA Airport app. And from Premera Blue Cross. Premera offers a variety of health plans for employers in support of their employees throughout the Washington State region. Learn more at business.premera.com.
Latest headlines now from KUOW. Seattle Mayor Jenny Durkan says she will not run for a second term. Durkan made her announcement today, saying running a re-election campaign would be a distraction while leading the city during the pandemic and the issue of police reform, among other items. Candidates interested in a wide-open race don't file paperwork until the spring. A federal judge says the Seattle Police Department is in contempt of court in connection with 4 instances of the use of blast balls and pepper spray during protests this past fall. The order comes after Black Lives Matter Seattle-King County filed a motion that SPD was in contempt of the judge's earlier injunction, keeping police from using force against people protesting peacefully. State transportation officials are considering raising toll route prices as the pandemic resulted in fewer commuter trips than expected. Those revenues are needed to pay off big projects like the 520 Bridge and the Highway 99 tunnel in downtown Seattle. The Seattle Times reports traffic is down by about half on those two routes. More KUOW news headlines coming your way in 10 minutes. It's 4:20. Support for NPR comes from this station and from CDW. IT orchestration by CDW brings together experts, technologies, and partners like NetApp to turn complexity into simplicity. CDW, people who get it. From Fidelity, with Fidelity Income Planning, Fidelity looks at how much clients saved, how much they'll need, and helps them build a plan for cash flow, so they can go from saving to living. Fidelity Brokerage Services, LLC. And from the listeners who support this NPR station.
From NPR News, this is All Things Considered. I'm Elsa Chang.
And I'm Ari Shapiro. Across California, ICUs are filling up, triggering another round of stay-at-home orders. That means no more outdoor dining at restaurants, only takeout and delivery. So servers, bussers, and bartenders are out of work again. Some, like Maria Buenrostro, have been struggling to find jobs since the first major round of shutdowns in March. She worked as a server and bartender at conventions and sporting events. And now, with all that on hold, she's had trouble finding work and has been hanging on with unemployment checks.
At this point now, in December 2020, it's the tax-on game to see what I'm going to pay next.
Now, as Congress debates another relief package, the city of Los Angeles is offering 4,000 food service workers there a one-time stipend of $800. Applications open today, and I asked Buenrostro what that money would mean to her family.
$800 for the size of my family. I'm not even sure how backed up I am. I'm going to make the best use of it. I'm not sure if at this time paying a bill would make me catch up. I think I'm just going to use maybe a small percentage to keep food on the table, and the rest build essential stuff is like cell phones. I guess I'll pay a cell phone bill. It's very minimal. There's 5 family members here, and it'll be still pick and choose where I'm going to use it. And definitely for Christmas, I think that's out. There will be no special Christmas gifts. I think just as long as we're good on the table for Christmas. I don't think there'll be any Christmas gifts. I think it's very little, but it still helps.
Yeah, you said there's 5 family members. Are you the only person supporting that whole family?
Yes, I am the number one supporter here in my household, yes.
Tell us who's in your family. Who are you supporting?
My son that's 27, he's in college. My daughter who's 22, she's also in college. And my 16-year-old that's in high school. My mother that's here, I don't support her because she still gets her Social Security, but she's a handful being that she has cancer and, myself.
So, can you just describe what life has been like these last several months?
Well, when the pandemic started, I just already have not paid none of my bills. It's just been figuring out what am I going to pay. It's all about bills. It's trying to keep my house because I am paying mortgage here, and I'm just definitely, I have to cut cable, I have to cut the gardening, my grass is dead now. I mean, it's just figuring out those things. I'm trying not to worry about what's late and behind and months behind. Creditors been calling. I really don't know. I just want to put my hands up in the air. I had good credit before all of this. We were all good. My job provided and supported my family. You know, I was doing well before the pandemic. There was lots of work. There's sports, the restaurants. There was plenty of tips. I live off my tips. All of that is out the door.
When you describe the months of accumulating bills, the one-time $800 payment just sounds like a drop in the bucket.
It does. I'm not going to say it's going to save me. It's not. I'm going to use it wisely. If I do get it, it'll be essential bills like cell phone and internet connection, because right now kids are in school, so they're definitely always on the internet. So that's essential right now. You know, the city trying to help us with $800 is definitely welcome, but I would definitely like to see Congress help us out, bail us out with the stimulus package.
And if things keep going the way they are, how many more months do you think you can stay on top of this?
I think I'm going to start going more into government programs if I'm not already in some. And that just sounds horrible. I'm used to working for my money. I'm used to working 16 hours a day. So all of a sudden start relying on government, that to me doesn't sound right. But if it keeps on extending like this, I'm going to definitely rely on government services.
Well, Maria Buenrostro, thank you for sharing your story with us, and good luck.
Okay, well, thank you. Thank you for the wishes.
Healthcare workers are still having a hard time getting coronavirus tests. And as NPR's Laurel Walmsley reports, the lack of testing means there could be lots of asymptomatic healthcare workers caring for pretty sick people. In a recent roundtable with Joe Biden, Mary Turner, a nurse in Minnesota, told the president-elect something he found surprising.
Do you know that I have not been tested yet, and I have been on the front lines in the ICU since February?
You're kidding me.
No.
Guidelines from the Centers for Disease Control say that healthcare personnel should be tested if they're symptomatic or have a known exposure to the coronavirus. But treating COVID-19 patients while wearing personal protective equipment, or PPE, doesn't count as exposure that warrants testing. A recent survey by National Nurses United, the nation's largest nurses union, found that only 42% of registered nurses in hospitals said they had ever been tested for COVID-19.
It continues to amaze me that we are not doing this.
Michael Minna is an epidemiologist at the Harvard School of Public Health. He says while PPE generally offers good protection, there have been outbreaks at hospitals. At Brigham and Women's Hospital in Boston, where Minna runs a virology lab, one outbreak involved 42 employees and 15 patients. The hospital blamed patients not wearing masks, staff without eye protection, and employees failing to social distance while eating.
Now that is an outbreak that shouldn't have happened. I believe pretty firmly that we would not have seen an outbreak grow so quickly, and it wouldn't have even been able to get started if we were doing frequent testing. There are so many ways that a hospital could be doing this, and they're not.
Minna says hospitals could either use rapid antigen tests or pool PCR tests to do screening for the virus more cheaply.
They could have everyone swab and put 50 swabs at a time into one tube and run that one tube and pool the tests for very, very cheap. You could do whole hospital departments with one test for $50 a day.
California's state health department announced new guidance 2 weeks ago that strongly recommends weekly testing of healthcare personnel. But hospitals have struggled just to get enough tests for patients. Susan Butler-Wu is Associate Professor of Clinical Pathology at USC, and she directs the Clinical Microbiology Lab at a large hospital in Los Angeles.
So if we were to take something like this recommendation where, okay, let's say we screen everybody weekly, there's very few clinical labs that would be able to have that much testing available to be able to do that.
Butler-Wu says at her hospital, there are 10,000 workers that would likely need testing under the new guidance. And she says without operational support from the state, the new protocols are going to cause problems, including greater testing backlogs.
But as a country, because we don't have a national plan or a national strategy, this is the situation we find ourselves. Football players can get tests. People choosing to socialize and wanting to feel, safer doing so, even though it's a pandemic, can get tests.
But a program to test the country's healthcare workers? Nope. Many nurses and doctors suspect hospitals are worried that widespread testing could reveal asymptomatic cases and then result in quarantining critically needed staff. And for Minna, the Harvard epidemiologist, the lack of regular testing of healthcare workers raises other questions.
There's a clear problem when we're saying that the greatest risk people, the people who are the greatest risk to themselves and to their patients, are the healthcare workers, and so that's why we're going to give them vaccines before anyone else. But then when we don't have a vaccine and it's just testing, we say, don't worry about it, it's not a big deal, you don't need to be tested.
It's an approach, he says, that doesn't make sense. Laurel Walmsley, NPR News.
This is NPR News.
And this is KUOW 94.9 Seattle's NPR News Station. I'm Kim Malcolm. Coming up, an update on the president's private attorney who is now being treated for COVID-19. Our top stories from NPR and KUOW next.
Support for KUOW comes from Atlantic Street Center, providing counseling, early learning, domestic violence, and youth development programs for children, youth, and families since 1910. Learn more about ways to make a difference at atlanticstreetcenter.org. And from neighborhood QFC stores with a belief that there is much to be thankful for this holiday season. The QFC app and website offer ways to shop a selection of fresh food for holiday celebrations. Details about pickup available at QFC.com. QFC, love fresh, love local, love pickup.
And coming up this afternoon on All Things Considered, public health officials in Mississippi are calling on the governor to implement a statewide mask mandate.
It really sends a message how serious this is and that this is an important step for everybody to take.
A look at how that possibility is shaping up in about 5 minutes here on KUOW. More clouds overnight and a slight chance of rain, lows around 47 degrees, and tomorrow rain likely in the forecast with highs of 52, and then the rest of the week pretty much cloudy with a slight chance of rain. It's 4:30.
Live from NPR News, I'm Dwayne Brown. An advisory committee to the FDA will meet later this week to discuss emergency use authorization for the Pfizer COVID-19 vaccine. As NPR's Allison Aubrey reports, the first immunizations could happen later this month.
The advisory committee will meet in open session on Thursday, and if they like what they hear, the vaccine could be authorized right away. To start out, Pfizer has about 20 million doses for the U.S., so supplies will be very limited. LJ Tan is Chief Strategy Officer with the Immunization Action Coalition. He says healthcare workers and people in long-term care facilities are first priority.
This is a rolling process. Once one phase is more or less completed, we're already in the process of planning the rollout to the next phase.
Essential workers and older Americans come next. Experts say will likely be 2021 by the time all Americans can be vaccinated. Allison Aubrey, NPR News.
Speaking at the White House during a ceremony honoring several sports figures with the Presidential Medal of Freedom, President Trump was asked about his personal lawyer, Rudy Giuliani, who was hospitalized Sunday after testing positive for coronavirus.
Rudy's doing well. I just spoke to him. He's doing very well. No temperature, and he actually called me early this morning. It was the first call I got. Now he's doing very well. That's another champion.
Giuliani is the latest in Trump's inner circle to contract the virus as cases surge across the nation. The 76-year-old former New York mayor has been traveling around the country holding events largely mask-free. Giuliani's been using those appearances to continue spreading conspiracy theories to try to overturn the election. Stocks finished mixed today on Wall Street. Tech companies, including Apple and Facebook, got a boost, while oil prices slipped. The Dow was down 148 points. This is NPR.
This is KUOW News. I'm Kim Malcolm in Seattle. The Seattle Special Education PTSA took a vote of no confidence in Seattle public schools after a KUOW story revealed that a student with disabilities was repeatedly locked outdoors. KUOW education reporter Ann Dornfeld has more.
In Seattle schools, data show that nearly all students put in isolation or restraint have disabilities. Seattle Special Education PTSA President Janice White says the story of a black second grader put in a fenced play court for hours at a time was the last straw for her organization. It was time for us to take a stand and to make clear how much we condemn this situation that we find ourselves in year after year after year. White says her son was also locked outside his school when he was younger. The organization Families of Color Seattle called on the district to provide credible and measurable assurances that no more children will receive what they called the horrendous treatment at View Ridge Elementary. They said the district is failing the students it should prioritize, Black and Indigenous children and children of color with disabilities. In Seattle, Ann Dornfeld, KUOW News.
And we'll have more on Ann's reporting on this story in about 20 minutes.